moved in today, I need to get this stuff over to another case manager. So when detainees are transferred between the compounds, or even between theater and internment facilities, or to say they need some acute assistance and they need to be moved to a combat surgical hospital, the medical ownership piece can be passed from one nurse case manager to another, ensuring that the medications, the documents, the records, and pertinent information is follows them. It basically report from nurse to nurse. As nurses, we're trained to take accountability for the patients that were assigned from the time they're admitted to the time that we're discharged. And these tactics are equally applicable within this base of patients. Okay, so how do we determine these patients? As you can see, my great graphics, I have a nurse case manager. Now, basically, say we're dealing with compound 12 here, we're going to look at two groups of patients. And this is a broad example of how we can determine the population base for a nurse case manager. The estimate is based on these numbers are based on numbers from Kambuka, extrapolated from the monthly MedPass logs and a compilation of averages from daily sick call. So what we could do is we could take the monthly MedPass logs. So you would look at the monthly MedPass logs and see that, I want to make sure you can see the slide. You can see that, for example, detainee 1 is on, we'll use lisinopril again as an example. He's on lisinopril. It's a fair assessment that he is suffering from hypertension. We could automatically add him into the nursing case management database, and he would become the responsibility of that nurse case manager who has that compound. The second group that you look at are the acutely ill who require any type of follow-up. Examples would be somebody may suffer a fracture. They have to go to the combat surgical hospital for an x-ray. Let's say the provider, the compound physician, wants to see them back in 10 days post-splitting. It would be the nurse case manager's responsibility to ensure that detainee got back to that provider. Often, there may be 2 months in between detainees getting seen. Providers are so swamped, and they're trying to treat so many things. So this population would be identified by the daily sick call logs. So for example, detainee 675 got sent to the combat surgical hospital. That's accessible by MPs, by the medics, and certainly could be accessible by the nurse case manager. Once the nurse case manager has defined their population, then they can initiate some of the fundamental improvements that are needed for their medical care. And these include, let's get to the next slide. Education. Now, healthcare education is intrinsic to a nurse's training, and it's an integral part of their job, whereas detainees can benefit from formal classes on healthcare like we do at the Taji model. We have with the Taji model. We provide very basic overall health hygiene classes. We can use the same kind of education. We can continue that same kind of education, but I'm talking about further enhancing it. We envision nurse case managers out in the compounds, right on the wire, talking to detainees, visiting 30 to 40 detainees daily, doing assessments and looking for opportunities to educate on a daily basis. Once we begin to teach the detainees to care for themselves, over time we can decrease the amount of visits they actually are paying to the compound treatment rooms. These providers that are seeing 50 to 60 patients a day, maybe we can cut that number down. The other part, along with decreasing their dependency on our treatment capabilities, detainees hopefully will be more educated about their conditions, their medications, and ability to care for themselves beyond their internment. This is a fundamental nursing case management that presents itself as a perfect opportunity to increase health literacy in Iraq and to prove that we care about Iraq and all its citizens, thus winning hearts and minds. The second piece is continuity of care. Now, many of the physicians we talk to, whether it be the combat surgical hospitals or the docs right out on the wire at the compound treatment facilities dealing with the detainees, are absolutely irate that there's no longitudinal care. There's no longitudinal record of care. Nursing case management will ensure continuity of care through the continuum. we can ensure this can be accomplished. We want to ensure that we have continuity of care, and by providing a longitudinal health record. We talked about medical accountability, and that's one way to ensure continuity of care following transfers. In addition, case managers can assist with tracking diagnostic and consultative results, as they will be out at the wire in the compound treatment rooms following up on the detainees, whereas providers are forced to cover multiple compounds and unable to track labs until they're returned to that prospective compound. So as we have doctors move around from compounds covering different treatment facilities, some labs may not be addressed for 2 to 3 days, sometimes weeks. Now with the nurse case manager, they'll be addressed daily, and at least that information will be provided to be given to the physician's assistant, nurse practitioner. We could call them at whatever compound they are and ask for example, if we had a proton that needed some adjusting on the Coumadin. That's going to add a perspective that we've not had up until this point. So the tertiary aspect of the continuity of care supports clinical practice guidelines for some of the more chronic conditions in the detainee population. The case managers can track and provide a seamless transition between providers as clinicians rotate through the compounds in the theater. So they can see a longitudinal healthcare record, because there's going to be daily logs by the nurse case managers. Now, the final piece is to liaise on all of this between the nurse case managers and the Iraqi Ministry of Health, whether it be straight to the Ministry of Health, and the Ministry of Health puts these databases out, interprets the database and gets them out to physicians in the different geographical locations, or they, or we end up speaking directly to the providers, for example, in Taji or Ramadi or Tikrit. The Ministry of Health will have, and as they have in the past, they request numerous meetings with the 110 to discuss these nursing case management program proposals, because they see the benefit of us providing more care than just the wire. They see us providing, many of the physicians from Ministry of Health understand the dangers of sending people who've never started a medication come into our theater internment facilities, start 2 weeks worth of medication, and they're released with no record of care. I mean, sometimes we're making this worse. In addition to speaking to the Ministry of Health, we've also started to reach out to the Army Medical Command down in San Antonio to see if there's interest in a mentoring program for the Iraqi Regular Army Nurses Corps. Pardon me, a little discombobulated on that slide. So a simple way to accomplish this longitudinal healthcare record would be to maintain a nursing case management database. Now this is pretty simple. It's a spreadsheet that will contain a detainee's internment serial number, so we can identify them beyond the name. We all know there's a lot of Mohammeds living within our detention facilities. This will provide a primary history, a current list of medications, pending diagnostics or consults, and interactions with the nurse case manager. So whatever the education was, or whatever the interaction was between the nursing case manager and the detainee, will be recorded on a daily log sheet in a spreadsheet that would be accessible. We'll put it on the shared drive. It'll be accessible at every compound. It'll be accessible by every provider. The case management database could easily be created on, say, Microsoft Excel or Access, so that it can be exported to many different electronic health records. These Excel and Access both can be sent to ALTA, which is what Army is currently using for soldiers and detainees who have surgery. So, and we've used many of those spreadsheets and transferred back and forth without issues, so that would be a very easy thing to accomplish. So looking at that, this database, thus, like I said, could be used by the providers to track recent care. As time passes and the database begins to grow, so will the case manager's knowledge of their population base. Just like anything, if you're meeting with these folks every day, you're going to see that the provider the providers as well. You're going to have two things that the providers can rely on. You're going to be able to rely on their nurse case managers for valuable information, current information, as well as a database if they can't get a hold of their nurse case management. This also provides records for an International Committee of Red Cross site visits and a longitudinal record care for the Iraqi Ministry of Health to access. Now, we all know Red Cross visits are our favorite, but something like this, keeping a record of education, medical education, and us trying to do more for the detainee beyond their time of internment will certainly speak volumes to the Red Cross. Now, definitely need measures of success, and I looked at a couple different things of measuring success over a short period and a long period. I think we need to be able to evaluate. After bringing 50 some more nurses into the theater, I think we need to evaluate if this is something that is working and something that's sustainable. So short term, I looked at, for example, the 30-day pilot that we're looking at starting. We had determined some objectives that could be quantified. For accountability, we can track number of records and medications that are lost in movements. For education, we can track number of meaningful education segments that are accomplished. And for continuity of care, we can track turnaround times on diagnostics and consults. All right. Now, long term, I think we look at the measurements of long-term success. They're a little easier to track. So longer-term goals for this program should reflect some of the issues that correlate to Task Force Med initiatives. General Carvalho, some of your initiatives. These include clinical practice guidelines for chronic conditions like hypertension and diabetes. These are the issues that you felt strongly that we address, and these are some of the issues we address. This is actually, I'm not sure if you can see this in the slide, but I'd like to decrease the amount of evacs from the emergency medical treatment teams or the compounds to the combat surgical hospitals. A lot of that is unnecessary. There's some abuse of it. One of the measurements is we can ensure that we're decreasing the percentage of those evacs, decreasing the amount of detainees being seen at the compound treatment rooms. So instead of our docs seeing 50 to 60 detainees a day, maybe they're seeing 30 detainees a day. The other part of that is the medics are overwhelmed. If medic's only sending 50 to 60 detainees to see their compound treatment, seen by the doctor, that means they're triaging 2 to 3 times that amount. So part of that is they could use another hand by the nurse case manager who's out there on the wire already talking to 30 to 40 of these detainees, absolutely, triaging them, letting them know. Part of the detainees' desire to be treated is just to get out of the compound and interact with other people beyond the folks that they're normally interacting with. So we can help alleviate some of that. End state. The war is over, but the fight to win hearts and minds is not. This model has been successful in the United States. Nursing case management is a proven model, and the 110th Medical Battalion feels strongly that it will be successful within Iraq and Afghanistan theater internment facilities. It'll cover some pieces that are currently missing. Pending any questions, I'll be followed by Lieutenant Colonel Patterson, and she's here presenting on WebEx radiology usage. I do ask that if you have further questions, email me, or if you'd like to see a better copy of this slide presentation, which I'm sure you would, for further review. It is available on the shared drive along with my notes. I thank you for your time and hope you have a wonderful day.